There's no public policy more intimate or personal than health care. I know. It drove me into Congress because of my daughter's brain tumor. So I think this concern that you hear out here is understandable, and nobody should just dismiss it.
All right, that's Congressman Sestak holding a town hall meeting today in Philly. The topic, as you heard, reaction to the new health care law. Fair and balanced. Congressman Kingston's got a town hall coming up this week. Is it in Savannah, Congressman?
I'm going to have actually 9 of them, and the one tomorrow morning is in Valdosta, Georgia.
Okay. Congressman Kingston is co-author of legislation to repeal and replace the law just passed by Congress, signed into law by the president. I'm going to ask him about that in a second, but you should know that 2 recent polls show how Americans generally are reacting to these developments. Gallup has the president's approval rating essentially flat at 46%, so he's not getting the expected bump from the euphoria surrounding his big win. The Washington Post showing Americans split on the new law itself, 46 in support, 50 opposing. Congressman Kingston, don't you think once the benefits start getting handed out to people, for instance, youngsters 26 years old, up to 26, still being able to be on their parents' policy, don't you think that once they start getting receiving those benefits, they're not going to be interested in repeal and replace? Don't you fear that you're going to be characterized as being negative and the party of no forever?
Well, I think once people see that their premiums are not going down, and remember, there's nothing remarkable about free money. If somebody wants to pay for my children's groceries or automobile insurance, which I could argue are very essential, I would be delighted. But the reality is this administration in 2009 ran up a higher deficit than 12 previous years in a row. And so America has got problems right now with Medicare, Medicaid, and Social Security. Now we've added a new entitlement. 16,000 of the newly insured people are just going to be insured because of an expansion
I don't want to redebate the bill.
Medicaid.
I'm just asking, politically speaking, don't you think replace and repeal, historically Americans have been positive people, not negative people. Don't you think it's a non-starter as a platform for a political party moving forward?
I guess what I'm saying is there are going to be people who benefit from a new entitlement program, and that's yes. What I think our job is going to do is say, look, you could still decrease the premiums by doing things like giving individuals the same tax breaks as corporations when they buy health care, allowing people to buy insurance over state lines. Malpractice reform was totally ignored on this. Things that we can do that I think would replace this in a superior way, and I think people are going to be open to that dialogue. Remember, if this was a great deal, all the arm twisting and the Cornhusker kickbacks and the Louisiana purchases and the Gatorade in Florida and all the other side deals we'll never even know about, they would not have been necessary if this was a great deal for the American people, and folks know that.
But Congressman Sestak, is it fair to say, running from the left of Senator Specter in the way that Marco Rubio is running to the right of Charlie Crist in Florida?
I tell everybody when they ask me, am I liberal or am I conservative, I say I'm neither, I'm pragmatic. In the United States military, everybody had health care, and I didn't worry about my daughter or my family.
Wait, if it's not an ideological difference with Specter, why are you running to replace him?
Well, see, I do take the point of my colleague here. I do think Washington has to change, where politics has triumphed over principle. Arlen Specter left the Republican Party, where he voted 4 out of 5 times with George Bush for policies that drove us into the savage recession to help to deregulate Wall Street. So we have a philosophical difference on those of how he voted. But what I most was disappointed with how could someone change his party he gave 2,000 votes to and say, now I'm a Democrat, even though I voted for every policy George Bush. So I say that we've got to have somebody on the bench that's got to be better than someone who's run from a fight in the Republican Party.
Thank you for your service, Congressman. Good luck. Congressman Kingston, see you soon.